relatively simple things can be done to improve the health. I mean, the overall health, oral health and systemic health. And I think the example of the connection with chronic obstructive pulmonary disease is fundamental. So having better oral health and better hygiene will reduce the risk of complications. So it is, I think, what you have said, Shlomo, and what Lior has said, the opportunity that we have of working together will clearly benefit our patients and the population, of course.
We, as a dentist and periodontists, will screen undiagnosed patients for periodontitis, for diabetes, as you mentioned earlier, and we'll find many with diabetes that was undiagnosed. And if the family physicians will send us patient for treatment, and we reduce the diabetic complications, as an example, will fulfill our mission, to improve health, quality of life, and save lives.
In the past, we called it the metabolic syndrome, but nowadays, if you take cardiovascular disease, hypertension, obesity, diabetes, and smoking, and if you will add also hyperlipidemia, then you will cover almost the entire adult population. And of course, all of them will benefit from a better oral hygienic care. And you didn't mention one of the most important messages that I got from this workshop is the earlier you diagnose, the treatment of periodontitis is simpler. You don't need to go to surgical procedures
Yeah, it's
that
true.
may have their own risk. So early diagnosis and early detection brings much easier treatments and then maintenance. And you avoid those surgeries that may have, even not a big risk, but a small increased risk for complications, especially in the acute phases, really recently after recent MI, etc. So early diagnosis and prevention should be the message, early referral.